The social phobia. Are you afraid about going to a customer meeting? Need to give a speech, but feel like fainting at the prospect of doing it in front of the class? Are you afraid of going to a social event? For no apparent reason? It's possible that you have a social anxiety disorder. Social anxiety disorder, often known as social phobia, is a psychiatric disease in which the individual has a severe or unjustified fear of being embarrassed or ridiculed in social situations. Most of the time, these fears stem from a deep dread of being intensively observed or scrutinized for everything from how they dress, talk, or act to crucial work functions, like performing in front of a crowd, giving a presentation, or concluding a job interview. This phobia makes victims feel trapped or cut off from the rest of the world. Shyness is said to be directly linked to social anxiety disorder. Social phobia, on the other hand, is distinct in that it interferes with regular social functions. Although everyone experiences shyness at some point in their lives, conquering it is a different matter. It's time to seek help when it starts to interfere with your daily life and relationships to the point where you're ill with worry. Knowing the signs and symptoms of social anxiety disorder might help you diagnose and treat the illness before it gets worse. People with social phobia manifest two basic kinds of symptoms: emotional and physical. The emotional symptoms include an intense fear of being in situations in which you don't know people, fear of situations in which you may be judged, worrying about embarrassing or humiliating yourself, fear that others will notice that you look anxious, anxiety that disrupts your daily routine, work, school, or other activities, avoiding doing things or speaking to people out of fear of embarrassment, avoiding situations where you might be the center of attention. The physical symptoms include blushing, profuse sweating, trembling or shaking, nausea, stomach upset, difficulty talking, shaky voice, muscle tension, confusion, palpitations, diarrhea, cold and clammy hands, and difficulty making eye contact. This phobia is characterized by excessive anxiety in the presence of others. Sufferers believe that others are more confident than they are, and that others are superior to them. They are so uncomfortable with other people that they find it difficult to eat, drink, work, ask questions, ask for dates, or even go to the bathroom while other people are there. The good news is that this illness can be cured. For the past 20 years, a combination of talk therapy and drugs has proven to be the most effective in limiting, if not curing, the consequences of this mental illness. Antidepressants, anti-anxiety drugs, and beta blockers are used to help sociophobic people balance specific chemicals in the brain and reduce panic attacks. During times of high anxiety, people with social anxiety disorder learn to react differently to circumstances that provoke their anxiety through talk therapy. The therapist assists the patient in overcoming bad feelings about social circumstances, as well as the fear of being judged by others. Patients learn how their thinking patterns add to the symptoms of social anxiety disorder, and how to change their thinking so the symptoms begin to lessen. To be shy is quite normal. Everybody has gone through a similar phase. Getting past that stage is the difficult part. Ultimately, it ends up to building your confidence to a certain level for you to be comfortable enough to move normally. In case you've been diagnosed as a sociophobic, it is nothing to be ashamed of. With a little bit of therapy, proper medication, and enough support from people who believe in you, you'll slowly be able to socialize and function normally within a group without being too anxious.